This is Pretty in Practice, the podcast.
Opinions expressed on this podcast are solely those of our own as well as our guests and do not reflect the views and opinions of our respective employers, organizations, academic institutions, committees, other groups, or individuals. Welcome back to another episode of Pretty in Practice, the podcast. Today we have two special guests, Lajaysha McBride and Sharlette Terrell, who are nurses and will be joining us today to talk about the nursing shortage and their experiences as nurses. So as always, before we get started, we're going to do our doctor's diary question. So Shar, can you pick a number 1 through 5 for me, please?
4.
Okay, so the question is, what fictional world or place would you like to visit?
Fictional place to visit.
I can start. So I think I would do probably Narnia from the Chronicles of Narnia. Like I always thought it was super dope. So yeah, that's what I would pick.
That's
Anybody
mine
else?
too, D. Exact same thing.
I was thinking the
Yes.
same thing.
That's the first thing I thought when you said fictional world. I was like,
Justice.
Okay, have you all seen the new Netflix show as Kid Cudi's cartoons called Intergalactic?
I haven't.
Okay, it's kind of like just trippy. I'm like, okay, I'll go there just to say something a little bit different.
Okay, that's fair.
Okay,
I think I'm gonna go far left and say Bikini Bottom.
Oh, that's a good one. That's a good one.
That actually is hilarious. Oh my God.
That's a real good one.
Yeah, that's a good one.
Shar, what about you?
Probably Bikini Bottom too. Well, probably not
Okay.
even. I'm still learning how to swim, so.
That's fair. Okay. All right, so we'll go ahead and get right into the episode. I personally wanted to host this episode because prior to medical school, during one of my gap years, I worked as a nurse assistant. And so I got to see that side of nursing, and I think that was very instrumental in shaping like the type of medical student that I am and like the type of physician that I want to be, because I'm like, I was on the other side of the struggle at one point. So with that being said, we'll start with you, Shar. What motivated each of you to pursue a career in nursing?
Well, for me, I would say it was my children. So I don't know if you all know this, but I actually have twin boys. So I originally went to college at one point and it just didn't work out like that because I had got pregnant. So I had took some time off and started working at a pharmacy. And then my mentor had asked me, like, what is it that you want to do? And I'm just like, well, I really enjoy healthcare. And I really enjoy like the pharmacy aspect, but I knew that I just didn't have the time to be able to put into a pharmacy program. So I decided, I was like, I'll just try nursing. So my children pretty much motivated me to go back to school and to show them that, hey, even though I got off track, it could be done because of, it's not common to once you fall off, you pretty much just go right into motherhood and then you just stop there. But I wanted to keep going. So that's pretty much what led me there. And then the fact that my significant other, which now is my husband now, he sacrificed so much for me to be able to go to school. So I'm just like, I have to finish. So that was my motivation, was to show my kids that even though I got off track, I can still do it, pick up where I left off and just kind of go. So I just chose nursing, and the fact that it was going to grow at the rate that it did and the job security was there. So that's pretty much.
I love that. I love that.
And can I say one thing, because people might not know this? Shar is my sister-in-law.
Yeah.
My sister-in-love, and I just want to big up her because she's cutting herself short. Like, she did nursing school as a full-time mom of twin boys, working full-time in the pharmacy, and she was just like superwoman. So I'm going to give you a shout out for that.
Well, thank you.
That's amazing. Lajaysha, what about you? What motivated you to pursue a career in nursing?
I really say that nursing found me. So my first 3 years of college, I was going to school I wanted to be an OBGYN.
Okay.
I was inspired by the Cosby Show. Ever since then, I'm like, that's what I want to do. I want to work with babies. I want to work with pregnant moms. Similar story. I had a mentor ask me, why do you want to be an OBGYN? And when I started describing it, I was like, well, I want to work with the moms. I want to help them through breathing and coaching. And she was like, everything you described was a nurse. She's like, the doctor doesn't do any of that. They come in, they deliver, they make sure mom is good, and they leave. Literally, I thought about it the next day. Then I went to the counselor's office. I'm like, I'm changing my major. And I switched over to nursing. And like I said, it's kind of just like a full circle moment because I came into labor and delivery nursing. So I'm still with the pregnant.
Oh,
So, yeah.
nice. I love
Beautiful.
that. It really is. Okay, so Lajaysha, what does a typical day in your field, so in labor and delivery, what does that look like as a nurse?
Typically, you definitely have to be ready for any and everything. I always say like labor and delivery has an aspect a little bit of ED because you do get those calls like, hey, we have a mom that delivered on the side of the road. They're coming in with the baby already delivered. So typically, like when we come in, you do our typical huddle, getting that idea of what patients are on the floor today. Sometimes that could be you got your report, and the moment you're walking into a room, it's like you tap out, I tap in, and I can go right into pushing with the patient because we're already in the process. So labor and delivery is definitely you have to stay on your toes and you have to be ready to shift at any type of moment because anything can happen. But other than that, it's a lot of teamwork. Most of the time, our doctors are always available because they have to be on call to deliver. But yeah, I always say it's like a mix of because we do triage patients too, so that's why I always say it's like a mix of ER a little bit, and it's always excitement. Majority of the time, it is happy times. But I will say
Okay.
during COVID, we did have a few more sad moments just because they were still trying to figure out what COVID was and how it affected pregnant moms.
Okay. What are the hours like in labor and delivery for nursing?
You're definitely looking at 12-hour shifts, still three
Okay.
days a week. If you go the clinic route, then you're looking at Monday through Friday, 8-hour shifts, but I was working in the hospital.
Okay,
And
nice.
are you on call
And,
too, similar to the doctors, or no? Does that apply to nurses too, being on call?
You said, do
Lajaysha?
I go on call? I'm sorry.
Yeah,
No,
as a
typically,
nurse.
yeah. When we're in the hospital, you just have your shift where they do have some
Okay.
positions that are more like flex or PRN that you might be on call, but when you're full time, you just know when you're coming in.
okay.
Okay. Nice.
And Shar, what does a typical day in your specific field of nursing look like?
So my role is different. Like I pretty much do not do hands-on patient care. So I'm in like an administrative
Mm-hmm.
role at this moment. So my typical day, depending on the day of the week. So if it's like a Monday, like tomorrow, I will go in, and then I have to sit with the IDT team, and we can go over
Mm-hmm.
clinicals from the day before. We're checking orders to make sure the orders are inputted correctly. I'm going over residents who have. So I work in a skilled nursing facility. So we refer to them as residents. So they're actually patients, but we call them residents. So we go over like the previous day, what had happened, if there's any change of condition, anybody had a fall, anybody who has had any type of skin injury. So then we're going to create a care plan, and that's what usually my role is. I create the plan of care for all the residents who are in the facility to make sure that they're up to date. And then also another side of my role will be reimbursement. So I actually have like a schedule that I would make out for the
Mm-hmm.
residents who require an assessment to be transmitted every 92 days to CMS, which is the Centers for Medicare and Medicaid. So on top of that, I'm in meetings trying to do clinicals, create the plan of cares, and then if we do receive referrals from the hospitals, that we also have a acute rehab side too for the hospitals who need to send patients in to be able to get like their therapies before they go back to the community. So then we have to check the referrals to make sure these are the patients that we can actually take care of safely. So I'm doing that on top of trying to make sure I transmit the assessments at a timely manner. So it's just I just never know what I'm going to walk into when I get there because of the nurses shortage as well. And then I know we'll touch
Mm-hmm.
on that too, but it's been a challenge.
Yeah. Okay, that's a perfect segue, honestly, to the next point. So, according to the U.S. Bureau of Labor and Statistics, the country will need more than 200,000 new registered nurses every year until the year 2026 to fill the gap in care left by a retiring workforce. So, with that being said, and Shar, you already kind of touched on it, you can expand. Do either of you feel the impact of the nursing shortage currently in your position? If so, how is it impacting you?
Okay. Would you like me to go?
No, you go ahead
Okay,
and start.
so because my position focuses more on the clinical reimbursement side, I'm usually more protected, meaning that I don't usually have to work the floor. But because we're seeing the shortage, I'm having to work the floor, pick up hours on the floor to assist, as well as skim through paperwork, skim through documentation, make sure we are um, up to code in a sense. On top of that, and now since we have seen the nursing shortage, um, we have now changed our plan on how we staff the facilities. So now we're utilizing QMAs, which is a CNA, a certified nursing assistant, who can pass medications. So what now we're seeing is that all they can do is pass medications. We still need that nurse to do the assessment piece, and we're struggling and finding the nurses actually do all of it. So we're utilizing QMAs who cannot they can't assess patients or anything, so they have to go find a nurse, and then the nurse is responsible for those QMAs. So on top of that, like it's just I've seen a lot.
Yeah, I bet.
I would have to say that I definitely agree with the nursing shortage. I always get kind of tripped up when they say shortage because I feel like there's plenty of
Yeah.
nurses out there. I think that more people are waking up to the environment and it's turning them away from the field. As far as like the direct impact that I've had, I definitely would have to say that there were a lot of shifts where you didn't get lunch breaks. We would joke about the fact that like, have you gone to the bathroom since we started the shift? And I was like, no, I haven't had time to pee. Like we did start to experience those type of things where now it's taking a physical toll on us because we're not drinking water. You're go, and it's kind of just at the time you can't complain because everyone's going through it. So I would definitely agree that it did take a toll on, I don't think just the hospital staff, but just
Yeah.
all nursing staff, because we definitely had to pick up where there was lack. Days on your days off, you're getting texts from your manager, hey, can you come in? We need extra shift. And now that's kind of taking you away from your time with your family that you kind of get to just de-stress to, I don't want to check my phone, and I had to put them on do not disturb because it's like you're not about to keep bugging me. Like I'm mentally tapped out and I need this break away from the hospital. And then two, I work night shifts. So 12-hour night shifts, your days are never the same. Like you sleep all day when you're off, and then the entire world is on a different schedule than you are. So even dealing with that, like me and my husband, we're on totally different like schedules. I didn't get to spend time with him because I'm asleep when he's awake, and I had to work, and I did pick up extra shifts to help the staff. But sometimes it pulls on your heartstrings. It's like I really want to take off, but my team really does need me. So I definitely would say that it has impacted me in a major way too.
For those of you who don't know, I actually am a nurse recruiter, and I can definitely say that I have felt the impact tremendously in my role with the shortage. I mean, it's just, especially ever since COVID, I mean, it's been very challenging for us because as recruiters, I work for a hospital system directly. So I don't handle, I used to do per diem and contract labor, but now I'm on the hospital side. So I'm only doing permanent full-time positions. And I know for me, especially after COVID, it has been so challenging with so many nurses that have explored the travel opportunities and the elevated rates from travel. And so trying to convince someone who is coming from a travel assignment making thousands of dollars per week and trying to convince them to come over into the hospital side, it's been very challenging and very difficult. And we've had to get very creative with the ways that we recruit. We're really trying to promote the culture of our facilities because at the end of the day, you know, money definitely talks, but what I've learned is that the culture is definitely speaking for itself as well. So I've had to, you know, really promote that's the type of culture that our hospitals have. And but yeah, I can definitely say from that standpoint, I felt it for sure.
Yes.
Yeah, I
It's just
also want to
interesting.
comment.
Yeah.
Oh, go ahead, India. You go.
No, I was just gonna say it's super interesting, just like all the components working together right now, like talking about the nursing shortage, and then we haven't even mentioned like the impact of COVID. So put that on top of a nursing shortage right now and just how that impacts quality care. I just wanted to know how you ladies have been able to successfully navigate because it feels like so many forces are in a way working against you, but you still have to be superwoman and heal people and try to, you know, provide the best care to them. Like, what have you done to navigate through all of these different components?
I'll say that for me, I know we'll touch into travel nursing, but I did take the travel nursing route myself. I will say that when I was still staff, I will say that because I think nursing is predominantly a woman's field. I think I want to say it's like 89% right now. They really do try to tug on your heartstrings as a woman, like, oh, we need you, the staff needs you, your patients need you, and it makes you want to give more and more of you because that's naturally in us. We nurture. So I've had to take a step back. Like I said, even me putting up the boundary or put my phone on do not disturb. Like I can't come in. Like yes, I'm available, but I need this time away. And you kind of just have to know yourself and have to speak up and stand for that. You can still deliver the best care to your patients while you're there. You can still be a great team member while you're there. But I've learned that over the years that it's the hospital's job to staff the hospital, not my job. So you kind of have to take that stand for yourself, or else you will experience burnout, and then you'll ultimately it won't be any of yourself to give to your family when you are off because you're so drained. So yeah.
So I'll have to agree with Lay on that because I am on the administrative side of things. So, like my facility, we are supposed to have 7 nurse managers. We're now down to 3. So we're all trying to pick up those pieces to still make it run, just make it work with just the 3 that we have. So when we do get those nurses who are coming off of the travel assignments or coming in applying for the positions, we just cannot pay them that rate, so they just kind of walk out. And then also too, with the shortage that I'm noticing is that the nurses now, they have like this big attitude. Like I've had a nurse tell me if I try to correct her or try to discipline her, she'll tell me, well, I'll just walk out and I'll find another job somewhere else. And that is true. So I'm having to come up with creative ways on how to even interact with these people because I need them like we do. And like the
Wow.
challenge.
I've experienced that myself. That's a very good point. I have definitely experienced that. It's just a for some, and again, this is just some people,
Correct.
definitely not putting, all nurses or whatnot in this category, but I've definitely seen a difference in an increase in the kind of maybe not as positive
Yeah.
interactions before COVID. And then after COVID, it was like it was more of conversations of kind of entitlement and you need me, and and I struggle with that myself because I'm thinking, if I'm applying for a job, I want to be, on my best behavior. Like I want this job, I want this position, but I have definitely felt that impact of, a lot of the individuals I speak to, they kind of have this attitude of, yeah, like you said, Sharp, I'll just go somewhere else. Like you need me. Like I don't need you. Like I'll just go and find a job elsewhere. And so I've definitely have had to navigate those kind of uncomfortable conversations and just kind of be real, with individuals I speak with that, just because you have a nursing license does not mean that you're going to automatically get a job. And I love the support that I've had with my hiring managers and my nursing floor directors because, they are very much like, hey, I know we have a shortage, but we cannot alter the culture of our facility just to get a body in the door. And, I've noticed that my hiring managers, they are very much like, hey, if you're not here to give optimal patient care, then we don't need you. And so that's something that I've definitely noticed though, and hopefully the culture can kind of change a little bit more in the positive direction, but I have literally seen it like night and day from before COVID and after COVID.
Yes.
Yeah,
It's
and
so
I also
funny.
wanted to speak on it from a medical student point of view too, because I work, or not work, but I'm placed at an outpatient clinic. And for me going into it, I knew like no matter what my duties are as a medical student, I want to help the nurses too, because I was on that other side. And I'll never forget what it feels like, to need help or need more time and then have like inpatient attendings, etc. And so for us, it's just very interesting because we've had a nursing shortage at my clinic since I started back in 2021. And so not only are we doing our duties as medical students, but oftentimes we are being asked to like room patients and kind of take on some of the duties that the nurses typically do. And so like as a medical student, it's not, like the worst thing because we're in the process of learning and we're learning from all of the healthcare providers. But I've also kind of seen how it's starting to impact residents because I've heard a nurse make a comment like, I don't like working with this resident because he doesn't room his patients. And it's like, well, technically that is not his job. And that entitlement comes in where it's like, well, because there's a nursing shortage, he should room his patients. But I'm like, yes, but he's a resident, so he has 100 other things that he's worried about, thinking about. He's being evaluated. Some of these interactions are being recorded. Like that person is focused on all the things that they trained to do, but are being asked to fulfill a role that they did not sign up for. So for me, it's been kind of like challenging to watch because right now it's okay because I'm a medical student, but I'm like, soon, literally in a year, I'll be a resident, and I'm hoping that it's not that same energy where it's like she needs to room her patients too on top of the other things that she's doing because there's a nursing shortage. So it's really like impacting us all. And I don't know, I just pray that it gets better. Um,
I just
but
want to
I'll
If
kind
I
of
could
go for it.
touch on two things. Oh, go ahead, just sorry.
Okay, I was just gonna say I want to add to that. Like you said, it definitely impacts the nurses, but it also falls on the rest of us who have to work with nurses. So I too work in a skilled nursing facility as a physical therapist. So a lot of things you said, Shar, hit home. Like I get to see those like outside of it as a nurse. Like having QMAs on the floor versus an LPN makes a big difference in my job. So if I have a patient who needs wound care or needs their meds or anything like that needs a nurse and we only have one QMA and then an LPN on the other side of the building makes a big difference. And so with that shortage, I feel like the CNAs and the aides expect us to kind of help out more than we usually do. So sometimes we do help bathe and dress and things like that to help assist with therapy. But it gets to the point where the CNAs and nurses expect us to do some of those things. And that's not really our job to do. Like it's not our job to get these patients cleaned up and dressed for the day. Like that's an aide's job, which we don't mind helping sometimes, but it just goes to show that like it kind of falls on us all when there is a nursing shortage, just because we all work as a team.
Correct.
Lajaysha, did you have some
Lajaysha,
comments you wanted to make?
Yeah, I was gonna say it's just so interesting hearing like the perspectives from a recruiter, from someone who works on the admissions, and then even as a med student, because I think we notice that I will say like even from the recruiter standpoint, I'm in a lot of the travel nursing groups, and it's funny that like what you describe as what nurses do, the nurses in the groups are describing what recruiters do, because now I feel like it's this shift that nurses are, I want to say, is more so like kind of in control of their career now. And even when it comes to, like you said, money talks, and it's the money aspect where nurses feel like, well, we should have been making this money, and now we actually have the opportunity. So some of them feel like they're experiencing lowball from recruiters because they feel on the end, like when recruiters can get them at a lower rate, they get to pick up on the back end. So some of the things that I see kind of like in the groups are like, hey, this is what my recruiter's saying. Some of the, you could read the tone of the message where you could see like a recruiter is getting snobby. So it's just so interesting hearing both sides. But I will say that attitudes have definitely shifted in this current, I want to call it nursing shortage. And even how you described as like the role shifting to you as a med student, and hit what Justice said, that it is falling on everyone, because even when it comes down to it, I want to say before the shortage, sometimes nurses would complain like, well, the doctor didn't put in their orders and I'll have to put in their orders. So it's kind of like it's going to be forever evolving and changing. And I do feel like a lot of roles will be, the description will be changing for everyone, just to accommodate for having lack of staff. But it was just so interesting hearing you all's perspective, and it's like, dang, that's what nurses be saying, but you all feel it on the same end.
Right.
Which is a good
I
point, and I think it's
it
like
is.
bittersweet, right? Because I feel like we're
Mhm.
at a time where, like you said, nurses are finally empowered, and that's a beautiful thing. Like you should have control over your career. You should be making a higher amount of money because nurses do so much. I always
So
say I can
much.
never do a nurse's job. Like I will go insane. Big kudos to y'all because I could never do a nurse's job because you literally do so much emotionally, physically, and then of course with the skills that you bring to help like save patients' life. So I do think there is a bit of positivity seeing the empowerment. I think just
Mhm.
maybe the tone of it might be impacting the whole entire field.
I agree. So just shifting gears just a little bit, Lajaysha, you talked about travel nursing. So what are your thoughts? What was your experience? How do you feel like, I think we kind of talked about how it's impacting the nursing field because now it's like we know our worth.
Yeah.
So can you talk more about like your experience with travel nursing?
I would definitely have to say, well, this last year for me, I've been in the nursing field for 4 years now, but I call this last year for me exploratory, because that's exactly what I've been doing. I will say that, I mean, being very blunt, coming into work, working alongside travel nurses, and you start to build relationships with them. You hear some stories that, oh, staff doesn't like travel. that depends on the staff, because I was networking, like, who do you go through? But realizing that we're doing the same job, and then you hear how much they make, because a lot of the nurses I worked with were very transparent. And I got to thinking, like, well, if you can make that much and we're doing the exact same job and you get to travel and do different cities, why would I not jump on the opportunity? Especially for me right now, I don't have any kids. Like, this was a perfect opportunity for me to go and explore. I will say travel nursing is bittersweet, so you have to take the pros with the cons. When you travel, you're away from family. You do have to be on the road a lot, and you're living out of a suitcase. The pros are you get to also navigate your schedule. If I don't want to work the holidays, I don't take a contract during the holidays, and I can spend more time with my family. When it comes down to it, I feel like just a lot of hospitals might have to start looking at the budgets, because nurses are going to feel like, hey, we do want a little bit more money for our hourly. But when it comes to travel pay, nothing's going to ever be the same, because they get paid so much because they're away from home. Like, if you're working at a hospital in your same city, you're kind of giving up that benefit of, well, we have to pay you for your food and lodge when you live in the same city. So like I said, I would say it's bittersweet. But ultimately, I would say I enjoyed my travel experience. But I would definitely say I did also stay in a humble mindset, because I didn't want to get a big head. Because said I have been in a lot of those nursing groups, and I agree with you, Lay, that a lot of them did get big headed, saying I don't want anything less than 5,000. I'm like, oh, COVID is starting to trend down, so will rates, so we have to be realistic. So.
And those rates are leveling out, and I'm also seeing that on
Yes.
my end, that the applicant pool is getting greater now that those rates are lowering. But I've always said, even though it makes my job harder, I don't blame anybody that has gotten into travel, because I mean, this is the time to do it. The rates were, I just could not believe some of the rates. I mean, you're talking nurses that were getting paid as much as full-time doctors. Like, I mean, they were taking advantage of those rates, and I'm like, if I were in y'all shoes, I would have done the same thing. Because, like you said, Lajaysha, you're in a great spot. You don't have kids. You have that flexibility. So I'm like, if that was me, I would have done the same exact thing. But yeah, we are kind of seeing those rates, lower now. We've actually made adjustments with our full-time rates at my hospital system, which I've been so grateful for. The nurses have been grateful for. So there are definitely a lot of positive changes that I'm noticing with those, decrease in rates. But, a lot of the hospital systems are kind of taking heed and looking at their budgets and things like that, and trying to make adjustments for those full timers that are going to be coming back from the travel assignments.
Shar, did you have any comments on travel nursing at all?
Well, I didn't get a chance to experience travel nursing, but I did get a chance to work with the travel nurses that would come through my building, and I didn't have a positive experience with them. I'll just leave it at that.
Oh, no.
Yeah.
She said, we'll keep it short and sweet. It was not a good experience.
Yeah. Positive.
There's
But
pros and
Lay
cons.
said it did allow our company did like a look for wages, and they were able to increase all of the floor staff's wages, because a lot of the floor staff were complaining. We're like, we'll just go work for travel, like hire me anyways, type of thing. So that's the positive aspect. But far as like the traveling, it was hard to kind of discipline them, because it was quality over quantity. So all I could do was just call the agency and say, please don't send that nurse back. That was pretty much it. And the nurse they would know that I'm here. I'm just going to sit here. I'm just going to pass the medication, and that's it. I'm not going to get up. I'm not going to leave. I'm not going to assess the patients. I'm just going to sit down. I'm going to eat my meal at the nurse's station type of attitude. It was the worst attitudes ever from the travel. And all I could do was just call and be like, hey, just don't send her back, please. Or just don't send him back. That was it.
So with that agency nursing, aren't most of those people in the city? Because I deal with that as well. Like most of our nurses are usually agency nurses, so they get paid much better, but they also do less. Like you said, they don't want to do anything but pass med. So I'll tell a nurse like, oh, so and so is soiled, or they like this person needs help, and they're like, oh, I'll find an aide. Like all the aides are busy. Like so now you have to step in and help. Like you're next in line, and they feel like they don't have to do that at all. Like they're also getting paid more, and then feel like they should do less, which is really mind-boggling to me, because I'm like you're the nurse, so you think that I should go in and help clean up the patient? Like that just doesn't make sense to me. Like you're getting paid extra money, coming into the situation, and all you think you should do is pass meds and chill at the
And from a former aide's perspective, I was like, I'm happy to have gotten this side of nursing and see how much you all do, because I do have a greater appreciation for nurses. But at the same time, and this was before COVID, I was like, they are so mean. Like, oh my goodness. And I get it. Like, you are being stretched thin because it's like you're trying to oversee the A, and then you have the doctor telling you to do X, Y, and Z all day. And like you said, sometimes they don't even put the orders in. So I can get it why it becomes like this is my attitude at work. But being on the receiving end of that, it really deterred me. I was never interested in becoming a nurse. I always just did it for experience. Like, I wanted the hands-on patient care. But after doing it, honestly, that's what motivated me to like go get my master's and get in med school. Cause I was like, I can never do this. Like, they are so mean, and like they're talking down to me as if I don't have like a degree from Purdue University. That was very challenging for me, because I was just like, okay, they're like, they're questioning my education and talking to me kind of crazy. I'm like, I don't want to be in this field of work. So it was definitely interesting. But I kind of want to end on a more positive note and ask you all, Shar and Lajaysha, to give advice for anyone who's interested in pursuing a nursing career.
You want? I would say go ahead and do it. If it's something that you really want to do, go ahead and do it, but do it for the right reasons. Do not do it because you have a potential to get rich off of it. Do not go into nursing for that, because you will burn out quick. And then also just look into the school of choice. Make sure that the school of choice also has a good pass rate for the NCLEX, because you could graduate all day long, but if you cannot pass that state board, it's like what's the point, in a sense? So just really do your research on the school and the NCLEX pass rate, but definitely do it if it's something that you really want to do.
Great advice.
I would definitely agree. I would say to those pursuing, don't get deterred by what's currently going on in the world of nursing. Nursing has been a great choice for me still, despite COVID and everything I've experienced, mainly because I've got to explore so many things. So like I mentioned earlier, this has been my exploratory year. So I've gotten the opportunity to do travel nursing. I've worked in the med spa, where I was doing IVs and hydration, which was a totally different clientele for me. I've also worked in surgery centers where I was like, well, I don't think I want to work there anymore. Let me go do this. And now I'm currently have a pending contract to work as a public health nurse. So even in this last year of long, I've got to experience and explore different fields of nursing, still utilizing my degree. So I would definitely say don't get deterred, because there is a lot of growth and opportunity from it. You can go into like the leadership and admin role, or if you really enjoy the patient one-on-one care, you can stay in that.
Nice. Well, thank you both for joining us today. That was really great advice. And I think this was a very good conversation for us and for our audience, honestly. And as always, no matter what journey you are on, remember to keep it pretty.
As always, thank you for joining us for the ride. Be sure to keep in touch by following us on Instagram and subscribing to our YouTube channel at Pretty in Practice. Feel free to send us a DM of any topics you want us to discuss, and you might hear them on a future Pretty in Practice episode. Keep it pretty.